Good afternoon, everyone. This is yet another deeply distressing day for all of us in Northern Ireland, because today we sadly reported our highest number of deaths to date. 18 more lives have been lost, 18 more families with their hearts broken, 18 more people that will have been loved and now will be deeply missed. But we must never forget that behind every death there are families and friends. So let me convey my deepest sympathies to them. But today's report should be a grim wake-up call to anyone who is getting complacent about what we are going through. As of this morning, we had 45 patients in intensive care, and yesterday there were 105 hospital admissions due to COVID-19. That was the biggest number this week. We are in the midst of the biggest public health crisis in the history of Northern Ireland, and as I said in the Assembly yesterday, we are living through scenes that only 3 months ago would have been wholly unimaginable. Yet we must realise that we are in the fight against this virus for the long haul. We have done well so far in keeping our distance and staying at home and following all the advice. But there is still a long way to go. So please don't let it slip now. Your actions now can save lives in the weeks ahead. Your actions can save other families from being plunged into grief and loss. This is a challenging time for everyone, but I absolutely recognise the hugely difficult circumstances of a family member wanting to be with their loved one in their final moments. On the 26th of March, my department wrote out to the trusts with a visiting update, when with immediate effect visits to hospitals were stopped. I was clear that the decision was being taken on the clear clinical advice that it was the right thing to do in the interests of protecting patients, their families, and all of our health and social care staff. However, there were a small number of exceptions, with one of those being for palliative or end-of-life care. We are all human. We all share similar emotions, so when feasibly possible, and with prior arrangement with senior staff, a visitor can be allowed onto a general ward to see a loved one who is sadly passing away. There is a particular issue with visiting COVID patients in intensive care wards. However, today I have spoken to a number of senior clinicians, and their collective expert opinion is that allowing significant numbers of visits to ICUs presents too significant a risk. Given the serious risks of infection, especially if PPE is not donned and doffed in exactly the correct manner. Such visits present a real challenge to both visitors and staff. However, this is something that I have asked the Northern Ireland Critical Care Network to currently review. So let me also say something about the fact that COVID-19 is such a threat to older people, regardless of what setting they are in. Their deaths are just as much a tragedy as any other age. So let no one ever suggest anything different. Often the final years of a life can be particularly meaningful and profound. Insights based on rich experience can be shared, relationships with families deepened, wisdom handed down to generations. Often roles are reversed at this stage, and children and grandchildren become the carers. They become the ones who do the worrying and the looking after. They get a chance to repay some of what their parents did for them. Bonds are deepened, rich and lasting memories are secured. So what we are dealing with are very cruel tragedies, robbing families of precious time together, and we must never forget that. We must make sure that health and social care services provide all the help and support that they can give at these times. I have heard hurtful and untrue allegations being made about deaths in the community, and in particular care homes. I can assure you, no one is being forgotten. Those of us in charge of the health service are members of this community. We are carers. We have elderly loved ones, some of them living their final years in care homes. So as this virus has taken hold, I've been keen to put as much information out into the public domain as possible. And shortly we will be launching a public-facing dashboard which will give the data that the department has been working on. But yes, there are challenges with publishing up-to-date information on deaths in the community. We and NISRA are working together through that as we always would have. But let me be clear again, every single care home resident, every senior citizen matters just as much as every other person in our society. So that is why we must stick to social distancing for as long as it takes, to protect the most vulnerable in society, to protect our parents and grandparents who have done so much for us. This crisis has also underlined just how important social care is to our society. The work done by care home staff and domiciliary workers must be recognised and applauded just as much as those in the other parts of the front line. So tonight at 8 p.m, once again, let us also all stand in our doorways and show how much we appreciate the health and social care workers and all they are doing at this time. Like never before, people are realising the true value and worth of the National Health Service and all the heroes who work within it. It is vitally important that we fully support everyone across the health and social care system, that they know we have their backs. As Minister, I have their back. Because today I was pleased to launch a new framework setting out how the well-being of health and social care staff and volunteers will be a key priority throughout the current COVID-19 crisis. It sets out a range of practical measures that will protect the psychological health and well-being of our workers. We need to make clear to everyone across the health and social care system that we have their backs. The framework recognises the changing needs of our HSC staff throughout this crisis, and I am committed to meeting those needs both now and in the future. I'll now hand over to the Chief Medical Officer, Dr. Michael McBride.
Thank you, Minister. Can I take this opportunity to extend my deepest condolences to all of those who have sadly lost loved ones in recent days. I also want to take this opportunity to express my sympathy and understanding of the worry that those individual family members have in respect of those who have been admitted to hospital over the last period or currently remain in hospital. What I do want to reassure everyone is that they will get the best possible care. I want to reassure you of the commitment and dedication of all our staff in health and social care services. The numbers, the people that this has affected is truly staggering. We are now moving through the peak of the current wave of COVID-19, and the impact has been seen in terms of lives lost and in terms of admissions to hospital and into intensive care. I just want to say that you, the public, have made a real difference. The social distancing measures that we put in place were absolutely necessary. Your adherence to those has been astounding. Your commitment to saving lives has made a difference, and you've ensured that our health service has been able to cope, has been able to provide the best care to those that need it. We have some very difficult and challenging weeks ahead. We don't yet know how long the peak of the pandemic will last here in Northern Ireland, so we need to continue to do what we're doing to protect each other and to protect our health service. In the weeks ahead, we will be considering how our response needs to change as the pandemic evolves and therefore our response will need to evolve. That may include us introducing, again, some of the measures that we did previously in terms of containment, contact tracing, and testing as the virus circulates less widely in the community. It will see us introducing further surveillance so that we get a clearer picture of how the virus is circulating and where it is circulating. And that is absolutely crucially important for any next phase in our response. But that is for another time. It is not for now. For now, we need to continue to do what we are doing. I just wanted to take this opportunity to add to the Minister's thanks to everyone in society in Northern Ireland, right across every sector, right across the public services, those who are working in the supply chain, whether to our health service or getting food to our supermarkets, or working to support those who are shielding in the community, to our community pharmacists, to our allied health professionals, our social workers, our healthcare workers working and supporting some of the most vulnerable people in our independent sector, in nursing and residential care homes, supporting people in their own homes through domiciliary care. This has been a real team effort. Our colleagues in the PSNI are helping us all ensure that we adhere to the social distancing measures which are saving lives. It is important that we continue to work collectively together to ensure that we respond to whatever this pandemic throws our way. Thank you.
I ask Professor Young to say a few words on the modelling.
So I want to speak briefly about the modelling work of the group which I currently chair. Whenever I spoke about this previously, I said that we would experience a peak in terms of wave 1 between the 6th and the 20th of April. Our ongoing work and careful monitoring of the spread of the virus indicates that we are at or very close to that peak now in terms of hospital admissions and intensive care occupancy. It is possible that we might continue to see a rise in deaths for another week or so. And today's very sad news in terms of deaths and bereaved families is in keeping with that. The fact that we have reached the peak now and that it is perhaps not as bad as previously anticipated is a tribute to the relatively high degree of adherence on the part of all of the public to the social distancing measures which are in place. Nonetheless, I need to stress that this is very much on a knife edge at present. It's absolutely vital that people continue to adhere strictly to the measures which are currently in place. Even a relatively small departure from that would be enough for us to see an increase in COVID again. It's very important that we suppress this wave 1 of the epidemic as much as possible in order to allow us to move forward and make decisions about how best to respond to the next wave. I mentioned a next wave, and COVID will remain a threat until a substantial proportion of our population have achieved immunity, either as a result of recovering from infection or successful introduction of a vaccine. This will require very difficult decisions, as Minister has indicated, in the future about how we can best continue to deal with the threat that COVID will present for the foreseeable future.
Okay.
Yeah, Ken Reid, UTV, these indeed are shocking figures today, but there's still some controversy about PPE. And Minister Swann, could I ask you, first of all, do you regret returning 250,000 pieces of equipment back to England? And are you happy with the quality of the material that you're receiving now? And have you had to return any of that to the suppliers? And then for Dr. McBride and Professor Young, there is perhaps a perception that this is a disease that's particularly just hitting old people. Is there any evidence of the other age groups that are being affected? I mean, in terms of cases in ICU, is this affecting all ages, or is it really just hitting the older generation much more severely?
Thank you, Ken. Look, in regards to PPE, I've always been clear, look, at this point in time, no country ever has enough. And that's why we're taking the three-pillar approach that I've very clearly set out. It's the international pillar where we'll buy PPE wherever it is available. The national pillar where we've been supported from our friends and colleagues across the United Kingdom. We've received 5.5 million pieces of PPE from the National Health Service in England, the central UK stockpile. We've also recently received 36,000 pieces of eye protection from the Welsh Health Service as well. So in regards to the 250,000 gowns that you refer to, they weren't returned because they were of an inferior quality. They were actually sent to England from our stockpile about 2 weeks ago, because at that point in time NHS England had a severe pinch point in regards to gowns. We had surplus, so it was the right thing for us to do, because NHS England and Wales have supported us in the past and current with PPE when we've needed it. And as we move our way forward, I think that four-nation working with our colleagues in the Republic of Ireland will be a benefit to how we make sure in the next few weeks, when the surge does come and continues to be there, that we have the PPE that we need. In regards to the quality of the PPE we have in stock at this minute in time is the quality that is expected for our standards, because that is what we are buying to. Michael, do you want to?
Yeah, just in terms of the question and around individuals testing positive for COVID-19 or indeed those admitted to intensive care. As I've said before, and I think this is important to bear this in mind, this is not a disease to be trivialised. It affects everyone irrespective of their age. Sadly, we do know that individuals with underlying health conditions and certainly older individuals tend to have more severe disease. I think we need to, again, at this time, hold on to the fact that for the vast majority of people, this is a mild to moderate illness, and irrespective of age or underlying conditions, people make a full recovery. In terms of the age distribution of those who have been tested positive, over a third are under 44 years of age. Some 37% between 45 to 65, and 30% over 70. So again, that just shows the fact that there is no one immune from this virus, and that's what you might expect, because it's a novel virus, a new virus, to which very few of us have been exposed, only those who have been infected in this first wave of the pandemic. In terms of intensive care admissions, again, because it tends to be a milder disease in individuals who are younger, who will, by definition, in most instances, but not all, not have underlying conditions. Therefore, you will see an underrepresentation of younger people in intensive care. However, as you get into middle age, in terms of those over 45, you will see increased numbers of people in intensive care, and certainly in those over the age of 60 to 70, again, you will see a further increase in the number of people requiring intensive care support. So again, this virus is behaving as we anticipated it would behave based on the information that has been shared with us by our international partners. I think it's also important that we say that whilst this is a new virus, there's much that we still don't yet know about it, but thankfully through the international collaboration that's going on between our health professionals right across the world, through science and academia right across the world, we're learning more and more about this virus every day. And also, importantly, and again this is really important, in Northern Ireland we're part of UK-wide clinical trials to investigate the effectiveness of new drugs, and it's really important that we ensure that people can benefit from entering those trials personally, but also that the more rapidly we recruit to those randomized controlled trials, the more quickly we will have evidence about what effective drug treatments might look like, because it's going to be, as Professor Young said, it's going to be many, many months before we are at a stage where we have an effective vaccine. And part of our strategy in that interim period must be developing our understanding of more effective drug treatments.
Hello, it's Gareth.
No.
Hello, can you hear me now? Hello, can anybody hear me?
Yes.
Good. This question for all three, but perhaps primarily for Mr. Swann. These figures are a grim wake-up call. You say, are we now in that period, can we say definitively called the surge, or can we expect this to get worse before it gets better? And if that is the case, what does it say about the period known as, I think, the recovery period that the First Minister talked about yesterday? When is that possibly going to begin? What will it look like? Will it be customised for Northern Ireland specifically, or will we have to take whichever recovery period model Westminster lays down for us?
No, look, Gareth, and again, we've always been clear, and it was done from our modelling and the group that Professor Young led, that we expected to enter our surge between the 6th and the 20th of this month. Now we are doing that, and that's why we've seen a significant number of deaths that we've recorded today. But as Professor Young indicated, those are a follow through from the number of hospital admissions, the ICU admissions. So that trend is there, unfortunately, and we are seeing the increase in numbers. And unfortunately, as Professor Young has said here today, we anticipate those number of deaths to remain at a high number. Now, those are people, those are families, and those are individuals whose lives will be lost. But what we've been able to do through the actions that have been taken, through the social distance, through the regulations that we brought in, we have been able to reduce those numbers significantly from what was first envisaged. In regards to the recovery period, the Northern Ireland Executive has again looked to the regulations that were brought in regards to the COVID-19 bill. We brought those in just over 2.5 weeks ago. So there's a duty on my department to review those regulations and make a recommendation to the Executive. We reviewed them on Wednesday. We've recommended to the Executive that the current regulations that we have in place are fit for purpose, are proportionate and are necessary in regards to us, how we as a health department manage the number of COVID-19 cases in Northern Ireland.
If I could maybe add to that, Minister, I mean, I think that just to be clear that throughout our strategy is been to protect the vulnerable and to save lives. So there have been three main strands to this that we need to think about. Firstly, our approach has been to save lives directly as a consequence of reducing the number of people infected during this first wave, and there is evidence that the approaches that we have deployed have been effective in that regard. Sadly, however, as we've heard, significant numbers of people have sadly lost their lives, and that is deeply regrettable. The second important element was that we did not see indirect deaths as a consequence of people not being able to access the health care that they need when they need it. In other words, we couldn't afford to have our health service overwhelmed by people needing hospital admission, needing oxygen, needing admission to intensive care. And as Professor Young has said, while we still are moving through that peak, at this point in time, our health service, while under pressure, is managing with those demands, and people are getting access to the treatment and care that they need. The second element, however, is the unintended consequences of the measures that we have now put in place. And indeed, we are very mindful that there have been a number of procedures, operations, which have had to be postponed as a consequence of us trying to protect the population, treatments that have had to be delayed. Our health service looks very different, feels very different, as I have said, and it is important, and we are continuing to ensure that we mitigate as far as we possibly can the impact of that. And I want to pay tribute to our colleagues in primary care and all of their work in establishing the COVID-19 centres, but also ensuring that routine primary care services, insofar as is possible with the current social distancing, continues. And the third really important element of this, which is for all of us to be aware of, is the wider, longer-term socioeconomic impact. As I've said many times before, poverty kills people. It has so for generations. Unemployment and good employment is good for your health and results in gooder and better health outcomes. So it is crucially important that we don't seek to differentiate between the wider economic impact and the health consequences. They are one and the same. And increasingly, as we think about how we might manage the next phase of that, of this pandemic, those are going to be very important considerations, because as ever, it may be the greatest pressure is on those who live in the most socioeconomically deprived parts of the United Kingdom. It may well be those black and ethnic minority groups, all of those who need increased support as we move through this pandemic.
Can I just come in there as well, just to follow up, I think, on Dr. McBride's second point? I think one of the messages that we want to make very clear and get out of today's conference is, if you have a health condition, or if you feel you need to go to your GP, you need to attend an emergency department, should it be through cardiac or even stroke symptoms, we would encourage people still, the health service is there for you. The health service is there to support you with all your normal medical needs while we cope with COVID-19. So what I would say to people, if you feel you need to attend an emergency department or your GP, please do that, because your National Health Service is still there to serve and support you.
Good afternoon, gentlemen. David Young here from PA Media. Just want to talk about the restrictions, and obviously the weeks and months ahead may see some changes to the restrictions, some relaxation, some changes, so forth. But in regard to the vulnerable categories of people, people with underlying health conditions, the older members of society, in respect of their need to shield, is that something that will be constant throughout this until we reach a point where there is sufficient immunity in the community, or an effective vaccine does appear? And just linked to that, sorry, in regard to the latest modelling, maybe this is one for Professor Young, has there been any impact in regard to we've heard various figures about the anticipated death toll in Northern Ireland, has that changed or reduced any since the last time we heard from you? And just finally, a subsidiary point, which is there's been some controversy of late in terms of the regulations and restrictions about exercise, and whether driving to a point where you then take part in exercise is something that's people should be allowed to do that. I just would like your thoughts on that one. Thank you.
Professor Young, do you want to pick up?
So if I can comment firstly on the shielding issue, as has been indicated earlier, the elderly and the vulnerable who are currently being shielded are at the highest risk of severe complications of COVID if they develop an infection. And therefore, any decision to relax shielding would come with the highest risk in terms of pressure on the health and social care system, and also with the highest risk for the individuals who are currently shielded. So in terms of impacts and modelling, a decision to relax shielding would come at a relatively high cost until a point where there is a vaccine or substantial population immunity. In terms of the modelling to date and the impact on deaths in particular, we continue to keep that under a close review from a modelling perspective, discussing it with colleagues in the UK and the Republic of Ireland. At present, we haven't seen any reason to make changes in the estimates around potential deaths in the first 6 months of the epidemic in the presence of a reasonable worst case scenario.
Just if I might, Minister, just in terms of the policing of the regulations, which you mentioned as well, David, I think it's very important that, as I mentioned earlier, that I put on record again my thanks to our PSNI colleagues who are helping the health service and helping us all as a society in terms of adhering to what are very difficult social distancing measures. We all know how challenging this has been, and you've mentioned in particular how challenging it is for those individuals who perhaps are elderly, those who have underlying illnesses, or perhaps those that do not have the same family support or networks. I did have a conversation with the Assistant Chief Constable Alan Todd earlier today. I'm not an expert on policing, but again, I was reassured by that conversation that the principle of policing by consent is alive and well, and that the conversations that they've had with the public are around the necessity of the travel that you've alluded to and the reasonableness of that. Because again, in some instances it will be a necessity and therefore it's entirely appropriate. And then there's the test around reasonableness. And I was reassured in those conversations that the public are relating well and understand the importance of the measures that we're putting in place and that we need to stick to for the foreseeable future. Some of these steps around social distancing are going to be with us for a very long time.
Dr. Young or Dr. McBride, could I maybe ask either or both of you to explain why you think the peak here, based on the latest modelling, seems to be less deadly, less devastating than had been feared? And essentially, I suppose, what are the lessons that we can learn from this for the future waves of this pandemic, which we know are coming at some point, possibly later this year? And to the Minister, you obviously gave some good news to the Assembly yesterday in terms of the fact that this modelling indicates that perhaps some lives which may otherwise have been lost will now be saved, and lots of that seems to be down to the fact that people are obeying the rules and they are staying at home. But following on from David's question there around the policing of this, there is evidence of some PSNI officers simply going beyond what's in the legislation, basically just making up the law themselves. There is a story of a lady who was taking her son who has got autism to have a walk in a park. She was taking him in a car, perfectly reasonable behaviour to anybody, I think, and she was stopped from doing that by the police, saying that your legislation allowed them to stop her from doing that. That left the child in distress. I mean, do you have a concern here that as much as those may be isolated incidents, that if the public lose confidence in how this is being policed, that the need to maintain these very tight restrictions, perhaps for months for some people, may simply break down and people will stop behaving in the way that they have been very responsibly trying to stick to the law?
Sam, I think just to pick up on your last point there in regards to how the people of Northern Ireland have been reacting, I want to thank them and I want to commend them in the generality, because of the evidence that we've seen in regards to how people are actually following the guidance that has been laid out by the department and the advice and guidance that's coming out through the executive office and the executive colleagues, because it's through the population of Northern Ireland following that advice and guidance that we've been able to review and reduce the number of expected deaths, the number of people that we will see needing ICU, the number of people that we'll see on a daily basis entering our hospitals. And in regards to the specific question you're asking in the case, I think it was actually brought by the Vice Chair of the Health Committee yesterday in regards to the support of children, especially with autism, in regards to finding somewhere where they can take daily exercise or maybe exercise more than once during a day. And I think the guidance was that if it was there through clinicians or support health workers, if it was actually there in that individual's care plan, that it is something that should be done and something that should be honoured, because what we don't want to do is put additional mental health and strain and stress on families or individuals. So in regards to the policing of the guidance, I think as Dr. McBride has said, it's through the outworkings of the police and that reasonablest approach and policing with consent of these regulations, because we've been able to reduce the expected number of deaths in Northern Ireland by the consent of the people of Northern Ireland adhering to the advice and guidance that we've put out. We're not a police state, we're not nailing people into their houses, and it's by the goodwill of the people of Northern Ireland that we are now saving lives.
Yeah, just in terms of how Professor Young may wish to comment on this, I think that there is a noticeable difference in terms of, at least at this point, how the pandemic and certainly the epidemic within Northern Ireland is behaving compared to some other parts of the United Kingdom. I'd say it's early days, and again, complacency, as the Minister said, is our greatest enemy in this. It is fair to say that the virus and the spread of the virus and the epidemic is again more similar to that in the Republic of Ireland compared to some parts of the United Kingdom and indeed some parts of Europe more generally. There are undoubtedly a range of factors that contribute to that. I think the Minister has alluded to, firstly, the adherence of the public and the respect of the public in terms of the message to save lives and protect our health service. And again, just to echo my earlier thanks. But there are probably a range of other complex factors which may be feeding into that, and I don't know if Professor Young maybe wants to comment on that further.
Yeah, so I think from a modelling perspective, we intervened at a somewhat earlier stage of the epidemic than was the case in the rest of the UK. The evidence is that the adherence of our population to social distancing has been similar to that of the population in the rest of the UK, but has been high. And that has been an absolutely critical factor, and indeed remains a critical factor. I said earlier that this is on a knife edge at the moment. We're just at a plateau, and it's either going to turn down steeply or it's going to stay at this level for quite some time. And that comes down to continued public adherence to the social distancing measures that are currently in place. There are, as Dr. McBride indicated, some other measures which may be specific to Northern Ireland. One of them is probably our population density, which is significantly lower than the population density in major parts of the UK. And in addition, the age distribution of our population, which differs somewhat. So those are more subtle factors, if you like, which combined with the other things I've mentioned have led to a lower peak of this wave, in all likelihood associated with a higher proportion of our population who have currently not been exposed to the infection.
Okay, folks, thanks very much.
Okay, thank you.
Thank you.